Looking at more ways to flattening the curve, Dr. Hassan Sule from the Department of Public Health, National Open University of Nigeria, joins us from our Abuja studios. We'd like to thank you for joining us on the program.
Yeah, thank you very much.
All right, let's first look at community transmission stage we appear to be experiencing around the country. There have been several projections that the virus is yet to peak, and awareness has been said to be a major issue to the fight. But why do you think we still have that problem with people being aware of what COVID-19 is, the risks, and how indeed they can protect themselves?
Yeah, thank you for having me again. The messaging concerning with regards to COVID-19 has been at best mixed. Right from the very beginnings of it, it seemed like we weren't clear what exactly it was and how it is transmitted. At first, there were messages like it was airborne, and then there was times they said it was droplet infections, and now we're back to the stage where they say it's airborne, and then face masks need to be used by people. So a mixed messaging has characterized our approach to COVID-19. But as to why community transmission remains high, I think that's because apart from the easy transmissibility of the virus, we have a situation where people have to take care of their economics and have to take care of their homes. The best scenario would have been government coming in to support each and every household, but failing that, there is nothing you can really do reasonably to stop people from going into places where they're likely to come into contact with these viruses. I think that would rank among one of the major reasons why community transmission remains high. But the silver lining is that going by the pathology of this virus, up to 95% of people who come in contact with the virus would get well, will have the virus and get well without even knowing they've contracted it. So on the upside, as time goes by, there is a positive build-up of immunity in our society. But then again, the fear is that in the chain of transmission, the virus could come into vulnerable people who unfortunately would tend to lose
their lives, being at higher risk to them. But one of the priority areas to contain, and this is community transmission, we hear, is the points of entry. Take, for example, in the southwest, you have Lagos State as the epicenter in Nigeria, and then bordering, you have Oyo, Ogun, Ondo. These states are also in the top 10 highest cases that we have in the country. And restrictions in those states are not quite uniform. Do you think there is enough state ownership and perhaps even more state collaboration in this pandemic fight?
From the increasing numbers of community transmission, you'd be forgiven if you said there's not enough being done. But again, it is humans that transmit the virus, and human behavior is key. And now, for a society that is not wealthy enough to support households and then thereby tell people to stay indoors, I mean, you run the risk of having a spread like this. Lagos is the commercial center, arguably the commercial hub of Africa. So naturally, the surrounding states would feed into Lagos for sustenance, and the running around to make ends meet, it's natural that the virus will spread to surrounding states more easily. But what would states have done? That's tricky. This, first of all, the virus caught us unawares worldwide, and we didn't get to know. Some people say the COVID virus would have been in circulation from around October last year. So we didn't get to know that. So it's possible that this virus would have been transmitted longer than when we realized it at the end of March on our shores. that again is a problem. So what would governments have done? For a case like ours, the best bet I think would have been to continually message people, plead with them, appeal to their better judgments or to the nobler instincts within them and ask them to stay. Because when they stay, there is chance, we have a greater chance of
Fighting
cutting the
it.
spread of the virus.
We appreciate your time. Thank you so much, Dr. Hassan Souley from the Department of Public Health, National Open University, Abuja. Thank you for joining us at this time.